ISU's Veterinary Center welcomed 13 children and their grandparents to Grandparent University. Attendees spent time learning more about veterinary medicine with some fun, hands-on activities.
We are learning how to use the stethoscope. First, we practice with the stethoscope on ourselves, and then we take it to the horse and listen over his trachea to listen to his lung sounds, and then listen to his heart right behind his left elbow, and then we listen to his gut sounds. We talk about the use of the endoscope to allow veterinarians to see areas that normally we can't access. So the endoscope in the horse we use to look in the airway, we look at the back of the throat, we look in the stomach, and we can look at the intestines.
So we have a smell station set up. The kids are having to smell and try to figure out what type of chemical they're smelling and what that chemical might be used for.
Any questions about the scope or how we use it? Hopefully your dog or cat never needs it. Hopefully they don't eat anything they're not supposed to. My dog does all the time, so don't feel bad if they do.
We are going to be talking about a number of different things related to anatomy where animals can adapt. We'll be discussing skulls and talk about their GI tracts. Talk about how gas exchange occurs. We're also going to talk a little bit about comparative anatomy with the bones.
So today with Grandparent University and with children, they're going to be introduced to some parasites that we see in veterinary medicine, and they're going to have a chance to look under both dissecting scopes and light microscopes and play around with different specimens that we have here in our teaching collection. And today we're going to actually be doing tick racing, which should be fun for the kids.
Today we are simulating surgery in our ever-popular teddy bear surgery activity. Our kids arrive and they choose an animal, and then they go through a physical exam with one of our veterinary students. We talk about the patient's health. From there, we go through a hand-washing activity to simulate the cleanliness required when you go into a surgical area and get them ready for surgery.